Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic are the basics of migraines. Migraines are chronic headaches that affect people from anywhere from a few hours up to 72 hours straight. It's a complicated recurrent headache disorder that's most common in women and those between the ages of 15 and 55. Most become less severe and less frequent with age. Migraines affect 18% of women and 8% of men, overall about 11% of the population. 30 million people in the U.S. have at least one migraine every year. Every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% of those with migraines have a first-degree relative who suffers. If one parent suffers from migraines, there's a 40% chance the child will suffer. If both suffer, there's a 90% chance. Over 90% of sufferers are unable to work or function normally during their migraine. There's a lot we don't know about what causes migraines. We do know there's a genetic component and environmental factors. We do know there's imbalances in brain chemicals, specifically serotonin. We know serotonin levels drop during migraines. Low serotonin, which is a pain management chemical, can trigger a migraine by letting too much blood flow through vessels that should be constricted, and that induces a throbbing sensation. Typical migraine triggers, there's quite a few. There are some foods such as aged cheese, red wine, beer, whiskey, food additives, cold foods, citrus fruits, MSG or caffeine, elevated stress levels, weather changes, strong scents such as perfume or paint, hair accessories like a ponytail, various forms of exercise, poor posture, skipping meals, and smoking. There's no evidence to clearly substantiate that chocolate is a trigger of migraine headaches, so thank God that's a myth. Keep on eating away. The symptoms of migraines, it's often a unilateral head pain that throbs and is aggravated by activity. An aura is a visual or sensory symptom prior to the onset of the headache. It could be photophobia or visual scintillations. Interestingly enough, 80% of migraines have no aura at all. There's no objective testing available to diagnose migraines. Most doctors will get a CT or MRI somewhere along the way to rule out badness, like a tumor that could be causing the symptoms. It's diagnosed on patient history and pattern of symptoms. A migraine diary can actually be very helpful to know how frequently they occur and how bad they are. The International Headache Society requires patients to have at least 5 attacks fulfilling 3 criteria. The first is a 4 to 72 hour duration. The second is at least 2 of these, unilateral, pulsating, moderate to severe pain intensity. Another one is aggravation by or causing avoidance of routine physical activity. And then 1 of these, nausea plus or minus vomiting, or photophobia and phonophobia. These are the abortive treatment options, meaning that you're already having a migraine, and this can help minimize it. There are various triptans that target the serotonin levels, so here you go. Amitriptan, elatriptan, Frovatriptan, Naratriptan, Rizatriptan, Sumatriptan, which is the most common, and then Zolmitriptan. Additional options include Migraine, Migrainol nasal spray, Cafrago, and possibly over-the-counter medications. There's quite a few of them. Most of these contain caffeine. Advil, Excedrin, and Motrin Migraine. Additionally, narcotics may help relieve the pain, barbiturates, and then anti-nausea medications such as Reglan, Compazine, or Phenergan. Now, preventive treatment options are designed to prevent the migraines from ever occurring. High blood pressure medications used off-label can be of benefit, such as beta blockers, calcium channel blockers. Antidepressants can do the same thing with Elavil or Pamelor. Anti-seizure medications, once again off-label, gabapentin, Topamax, Depakote, Sonomagran as well. The FDA has approved Botox injections for chronic migraines. They can be given in 3-month intervals. It's about a 10-minute procedure that involves 32 injections. It is covered by insurance if certain medications have been tried and failed. The definition the FDA puts on chronic migraines is that it's a distinct and severe neurologic disorder characterized by patients who have a history of migraines and suffer from headaches 15 or more days per month, with headaches lasting 4 hours a day or longer. The large study on Botox, which is how it got approved, showed that those who received treatment averaged 8 to 9 fewer headache days per month compared to baseline. Additional treatments for migraines include occipital nerve blocks, cervical facet injections, cervical epidurals, phenylpalatine blocks, supratrochlear, supra or infraorbital, and possibly pulse radiofrequency of occipital nerves. Out of a study of 100 patients receiving greater occipital nerve blocks, over half achieved pain relief averaging 3 weeks. Another study looking at greater occipital nerve blocks and refractory migraines used numbing medicine along with steroid. 54% of migraine patients reported on being significantly better afterwards, and the duration lasted up to 6 months. Now, this next study was amazing. They examined the benefit of greater occipital nerve and supraorbital nerve blocks in over 25 migraine patients who received multiple injections, but they got 85% effectiveness rate for 6 months. Very impressive. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state, including Austin, accepting over 50 insurances and providing over 25 treatment options with the board-certified physicians. Visit us online today at painmanagementaustintx.com and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.